Ari. Hello, I'm Kayla.
Gabby.
My name is Kenneth.
I'm Emily.
And I'm Brianna, and today we are presenting our project on the impact of exercise on the mental and physical health of adults with multiple sclerosis.
So now we're going to be talking about our abstract. We have our background with multiple sclerosis affects mobility, our balance, and our life quality. Aerobic exercise is something that can help us get through the different things that come with MS. And then the purpose of this study was to review different studies and see how aerobic exercise affected MS. When it comes to our methods, we use different databases to search through many different articles within the past 25 years. We focused on the studies measuring its mobility, balance, and quality of life, and we use quads and grades to assess the different studies that we used. For our conclusion, we were shown that aerobic exercise does help MS patients, and there needs to be more high quality long-term studies needed just so we can really see how it can affect over a really long period of time. So yeah. Introduction. So MS is a chronic neurological disorder of the central nervous system. Our main symptoms are our mobility and our balance. Our gender and onset differences. Women are more than likely to get MS, and it is 3 times more common in women when it starts around the age of 30. Exercise benefits of MS, it boosts the brain structure and it helps us with sleep. It lowers cardiovascular diseases and metabolic risk, and it helps with other neurological symptoms. The purpose of this study was to systematically review aerobic exercise and look into its mobility, balance, and how it will really help MS patients.
Okay, so the next topic we're going to talk about is the eligibility criteria. Okay, so for the MS study that we chose, we discussed the excluded and the included criteria for it. And so we did our study on 18-year-olds and up for this, and they were diagnosed with MS. And they had the interventions with their structure of physical exercise with the program. So eligible students in the program had the outcomes that were related to fatigue, mobility, balance, and quality of life. The excursion criteria for the study were involved in pediatric MS populations and non-exercise or alternative interventions. For the case studies that we used, they did not support any outcomes for the MS. There weren't any that we saw, but we used only randomized controlled studies and other methodology and measurable outcomes that were. So the next slide we're talking about our study, data collection, and our database. So we talked about, for our MS, we used the NetPub for our publisher, and it was focused on exercise therapies for the MS. They selected programs with a review of articles and titles for the topical reference, but it was really based on the full analysis that was ensured in the studies that we used. it was based on the included criteria, and it was based on the primarily outcomes that were included: fatigue, mobility, balance, quality of life, and the cognitive functions.
So we're going to be going over the bias assessments. The methodological rigor was assessed using two tools, the quads and the grade score. So the first one is the quads tool. It was evaluated each study's research integrity, the relevance, and the design quality of the research topic. For the grade tool, this determined the level of confidence in the results by examining the precision, consistency, directness, and risk bias in the evidence. Together, using both the grade and the quad scores, these tools allowed us to ensure the quality, dependability, and validity of the studies included in this review. So next we're going to be talking about the study selection process. So in order for us to select what process we will be going through, we had a selection criteria. So our main focus was benefits of exercise in multiple sclerosis patients. This included randomized controlled trials, cohort studies, and longitudinal studies. We searched these studies. We searched for them to be approximately from the years of 2000 to present day, 25 years, so it can be as relevant as possible. The studies involved patients at least 18 years or older, and we structured exercise interventions with clearly defined protocols. For the excluded ones, that included systematic reviews, meta-analysis, and some of the excluded portions included participants who belonged in the pediatric population, and studies that included any sorts of medications or alternate therapies in their studies. So for the key outcomes, so we looked at 5 different criteria. So the criteria that we assessed were fatigue, and fatigue we assessed them through utilizing the fatigue assessment scale. Mobility, which was measured by using the TUG test, which stands for timed up and go test. For balance, we looked for the Berg balance scale. For quality of life, we examined using the questionnaires like the MSQOL 54, so it's the multiple sclerosis quality of life questionnaire. So for the study characteristics, we looked for exercise interventions. So the exercise interventions included exercise like treadmill walking, cycling, doing aquatic exercises like swimming, or any structured aerobic fitness programs. These fitness programs, we were hoping to look for moderate or high intensity sessions, targeting the cardiovascular and motor function improvements. For the duration and frequency of these workouts, we were looking for the ranges of 20 to 60 minutes. They were conducted between 1 to 5 times a week, and they spent around 8 weeks to 11 months of consistent participation. For the control groups, they usually had either standard care, stretching routines, or no interventions at all. For our study types, we compiled approximately around 18 randomized controlled trials, 1 observational study, 1 uncontrolled study, 1 single-blind clinical trial, and 1 non-randomized control study. And for the outcome measures, going back to what we were talking about, or what I talked about in the previous slide, for fatigue, they used the fatigue assessment scale. For mobility, the TUG test. For balance, the Berg balance scale. And for quality of life, we looked for the multiple sclerosis quality of life questionnaire.
So for our key results, we looked at how our studies improved balance and mobility, improvement of quality of life, and cognitive function. So for balance and mobility, we found in one study, Gruppner et al. Both of these studies, by the way, looked at aquatic exercise. Specifically, the first study looked at haloic and aquatic polymetric exercise programs, and that study found that those aquatic exercises improved dexterity in hands and overall stability in the body. And then Carr et al. Found that water-based exercise programs can be effective and accessible rehab strategies for improving physical function, since aquatic exercise is a full body form of exercise.
Additionally, both of these two studies also talked about aerobic exercise. For the first study, it was testing high intensity exercise, which showed reduces in fatigue and also improvement of quality in life. Second was a study by Wenz et al. This was also testing aerobic exercise, but additionally it was testing Pilates. Both of those together showed to improve fatigue, physical functioning, and quality in life. For cognitive functioning, Feinstein was a study that was testing exercise training and also VR techniques. With the combination of the two, it showed improvements in cognitive functioning. Selman was another study that was testing aerobic exercise. This one, they looked at not only the impact of aerobic exercise, but its impact on the CNS. It found that exercise works in reorganizing the brain and neuroplasticity, overall improving cognitive functioning.
So overall, from these results, we found that exercise consistently did improve cognitive function, fatigue, balance, and mobility in MS patients. So with these studies, it was also shown that exercise improved the mental aspects of MS that people don't often think about, as it was shown to reduce feelings of depression, fatigue, and also improve overall cognitive function, which shows that exercise can be more of something that helps you with the mental aspects of your health and not just the physical benefits that we usually see in study. And so this table presents the summary of our findings going between each individual outcome, looking at quality of life and depressive symptoms, fatigue, cognitive function, neuroconnectivity, motor control function, balance, and muscle contractility, as well as improvements in endurance. And using the quad score and the grade score, we went through and assessed each of these and synthesized them together to get a total amount of studies that showed these results, as well as the amount of subjects. And so, for example, with improved quality of life and function, we have 11 studies with 416 subject studies, and a median and mean quad score of 31.75 and 31.8, giving us a moderate grade score compared to decreased fatigue, which has less studies than subjects at 8 and 234 with similar quad scores. However, we rated the certainty of evidence high, given that a significant less amount of subjects gave us a relatively high quad score. It made us more certain of the evidence compared to studies that had more participants with lower qualities in the study, which deemed them to moderate. And we also, again, speaking of cognitive function, saw that 6 studies with 367 subjects showed a much higher mean and median quad score of around 33, leading to a moderate certainty of evidence, given that only 6 out of 22 studies showed that. Looking at neuroconnectivity, this is not something we originally anticipated in finding, but this seemed to be a theme that people were exploring in these studies. However, only 2 showed improvements in that between 105 subjects, but it did yield a median quad score of 38.5 due to the quality of the studies, but again, certainty of evidence is low considering that 2 out of 22 only showed these improvements. And looking at overall motor function and muscle function, 8 studies honed in to show that this was a factor in MS that was improved by exercise with 451 subjects. And again, with a mean quad score of 35.68, this gives us a higher certainty of evidence given this number of studies and the number of subjects. And finally, though endurance wasn't something that was highlighted too much in research, 4 studies of 282 subjects did show that there was some evidence that exercise helped to improve endurance in MS patients, but again, this is not something they were looking for particularly. So the certainty of evidence is low, given that that's not one of the study criteria. It just happened to be a key result.
Now, although we are confident in our results and our findings, there are some potential biases after using quads and grade scores, such as selection bias, performance bias, detection bias, attrition bias, reporting bias, and intervention variability. Our research could have been benefited from identifying where these external biases are in our research and then enhanced our confidence in our results.
And so this Prisma diagram is again showing our flow of the study and what we screened. Using PubMed exclusively as a database, We screened through around 241 records using the keywords MS, multiple sclerosis, and exercise because we wanted to be able to keep it broad and open to understand exercise in MS rather than honing into a specific intervention like rowing, swimming, that there weren't too many studies done on. And so out of those, we excluded 201 because either they were incorporating another type of disease, they were a meta-analysis, systematic review, or something that completely didn't relate that happened to pop up. So from those 40 that were left, we excluded 18 because again, they were an inappropriate study design, or we could not access the full research through PubMed. And so from that, we were left with 22 to extract evidence from and come to conclusions about MS and exercise.
So overall, based on the studies and research we found, we had determined different standards for future research. These include standardizing exercise protocols, conducting large, high-quality randomized controlled trials, and looking at different intervention types, exercise durations, and frequencies and intensities that best benefit those with MS. And overall, we found that exercise did help MS patients both mentally and physically. Overall, we found that positive effects include fatigue reduction, enhanced mobility and balance, improvement in quality of life, and reduced depression and anxiety symptoms. Despite limitations, these finds support the idea of exercise being a safe and beneficial and non-pharmacological intervention, meaning medicine is not needed. It's also cheaper because exercise can occur anywhere.
And so these are the references we used throughout our systematic review to come up with these conclusions.
Thank you for listening.